Welcome back to the Nimble Youth Podcast. I'm your host, Matt Butterman, and today we're continuing a really important series on depression in kids and teens. If you've been listening, you know we're breaking this topic down by age because depression doesn't look the same in a 7-year-old as it does in a 17-year-old. Today we're focusing on middle school, that tricky, high-change, emotionally intense stage that so many parents struggle to understand. And I'm really glad to welcome back Dr. Gretchen Hoyle. Hoyle is a pediatrician with over 25 years of experience. She spent the last decade focusing more and more on pediatric mental health. Before we start, we remind you that this podcast is intended for informational purposes only and does not substitute for medical advice from a qualified mental health or medical provider. Please visit a healthcare professional with any questions about your child's mental health. Dr. Hoyle, welcome.
Thanks, Matt. I'm really glad to be talking about this age group. Middle school is really a pivotal time for most kids.
Yeah, it really is. So let's start there. Why is middle school such an important age when we're talking about depression?
Right. So middle school is really the perfect storm, right? So you have puberty starting, major changes in brain development. I always say to people, the brain goes through puberty too. It's not just the body. So increasing academic expectations play a big role. Like when kids move into middle school, they're expected to be able to just keep up with more. That there's a higher expectation of executive functioning, and more I see middle school kids who are taking, high school level work. And so that tends to put some pressure on them. And then suddenly the peer relationships can carry a lot more emotional weight. And what I see clinically is that middle school is often the first time depression becomes clearly diagnosable. Before this, kids may have more anxiety or emotional sensitivity, but then during middle school, those symptoms can deepen into depression. And a lot of what parents see is just sort of getting written off as, as puberty, hormones, a good attitude, when really there's something more serious going on. And so it's important for us to know what the signs are.
Right. But how common is depression in middle schoolers compared to younger kids or their older teen counterparts?
Right. So here's sort of the way that this stacks up. So to back up to elementary school, it was like 1 to 2% would need a diagnosis. By middle school, it's like 3 to 5%. And then it just climbs quickly as kids get older. So by high school, the rates by late adolescence, like 15 to 20%. So it's pretty substantial. Middle school is often where depression first becomes visible and impairing. It's not just moodiness. It's a real shift into like difficulty to function.
Yeah. And so what does depression really look like in middle schoolers? Because it's not always just being glum or just sadness, right?
Right, exactly. A lot of parents expect depression to look like crying or saying, I feel sad, but that's not what I usually see. The biggest thing is irritability. It's just that persistent, like irritability, grouchy. And, I think we all expect that from our kids. But when it's a persistent thing, it seems to be impairing their ability to function, and it just is sort of relentless, then I do sort of, I think it's time for us to take notice. Withdrawing from things that they used to enjoy. So a lot of times in middle school, kids will sort of shift around their interests, sports that they used to enjoy, they may not want to do anymore. They may pick one, or they don't like, doing music lessons, whatever it is that they're just, they're changing. And so they should definitely have some freedom with that. But if they're really just withdrawing from everything, even things that they used to enjoy, then that's kind of a red flag. Loss of motivation. So just cannot get it together to get stuff done. And of course, in middle school, the stuff is typically some combination of academic, assignments, and then some expectation at home as far as like maintaining their room or their clothes or their, chore kind of things. And with kids who just have no motivation to do that, that's concerning. And then if that's happening, of course, for long enough, then you're going to see, academic performance go down. So you start to see the grades go down. Sometimes that's the first thing that parents really gets their attention, in that they can see the grades dropping in whatever the parent portal is that they're using for school. So even though it may have occurred to them, kids seems a lot more irritable than they used to, but maybe that's just puberty. But then when you see that their grades are going down, you have to sort of think to yourself, that's time to sort of intervene. They often will have increased conflict at home. A lot of this conflict is about the declining grades and the lack of motivation and this just sort of withdrawal and stuff, as parents are trying to, get their child to kind of right that ship and get back engaged. And a lot of times kids will just say things like, I don't care. I just don't want to do that. I don't care. I don't care what you say. I don't care what I'm supposed to do. I don't care about the future. I mean, a lot of times they're saying stuff, but it's hard for kids to conceptualize how what they're doing in middle school is going to set the tone for high school, and then that's going to go to college. I mean, I know that it sounds like a broken record to them when parents say these kinds of things, but for kids who are really just sort of repeatedly like, I don't care about that, then that's something I would probably ought to try to get a handle on, because that's often what they're saying, when in reality, if they could be more like specific about it, is like, I feel sad, I feel depressed, and that's why I don't care. But a lot of times it's the behavior that's telling the story.
Was this different from depression in younger elementary age kids?
Right. So younger kids typically show depression more by, their outward behavior. And they also have a ton of physical symptoms like stomach aches and cleanness and regression and stuff. Middle schoolers will internalize more. They for sure have physical symptoms as well. So see a lot of kids, in this age group who have recurrent belly pain or headaches, or sort of these episodes of sort of, I think is like autonomic dysregulation, where they often feel faint or dizzy when they get anxious. And then that can lead into sort of reducing their activity. And then their symptoms look more like depression. So there's a lot of like overlap with these conditions. In middle school, they internalize things a lot more than they did when they were in elementary school. They are more aware of peer comparison, which is, a nightmare if you're growing up at the time that we're in right now, where there's just so many opportunities for comparison. Like, it's just never ending exposure to comparing yourself to other people on social media and stuff. And it's part of why we prefer that not happen until later. But that's an ongoing, I think, conversation for parents, kids in this age group. They tend to be much more sensitive to social rejection. That's part of the problem with social media, is that their brains are pretty squishy. And so when they feel rejected, it's a pretty deep cut, as opposed to like an adult where you're like, that's, hurts my feelings, but I'll get over it, but for middle school age kids, that's a much harder thing to do. And they're just more really capable of negative self-talk. This is a big thing too. They will just be super unkind to themselves internally. And so their distress is like quieter, but then often like deeper than what you're seeing in elementary age kids.
And so I'll ask the counterpart to the last question I asked, which is, how does middle school depression differ from what you would see in high schoolers?
Right. Yeah. So high schoolers, when we think of high school, they're in puberty, but they're pretty far into puberty, and they're really having more and I think that we're feeling like it's probably mid-20s before people reach their full frontal lobe development. But at the very least, people in high school are going to have more insight and autonomy than they do in middle school. And so they may have better ability to recognize that they're feeling sad and that there is something sort of pervasively problematic for them. And so they're able to refer or direct themselves in for help. Middle schoolers are kind of in between. They're emotionally complex, or they're more emotionally complex than younger kids, but they still rely heavily on adults to notice what's going on with them and intervene. And that's made screening and observation really important at this stage.
Yeah. So we've often talked before about anxiety and depression being comorbid or overlapping. Does that still apply here a lot?
Yes, for sure. So this is for sure true. Like, the younger you are, the more likely the anxiety is going to be the predominant thing. And it's certainly going to be the way that the thing that gets presented first. So, that anxiety can often, they'll have a lot of perfectionistic sort of thinking, and they're sensitive, and things sort of throw them off. And so if you're having chronic worrying about school and friendships and family and performance, and that can really, wear people down over time, and emotionally, it eventually could lead into depression. And that's why we typically will assess for both anxiety and depression simultaneously.
Yeah. So how do you actually assess depression in a middle schooler?
Sure. So we use the structured tools that we've talked about in previous podcasts. So for the anxiety, we often use a tool called the SCARED questionnaire, where you have a parent and child version of that. And so it's important to get the child version and the parent version. It's interesting that around middle school, like a lot of times in elementary school, the parent score on the questionnaire is higher than the child score. And sometimes I think it's just kid may not totally understand the question, not really be able to like articulate it. There's like you ask them something and they'll say, well, that's a no for me. But then the parent score is a little bit higher because they can recognize it more. Somewhere around middle school, that tends to shift. So the kid's score tends to be higher, mostly because they're sort of hiding what's going on. The parent are maybe not aware of the anxiety that they're feeling. So these are questions on the scared questionnaire, things like, or the items are like, I don't like to be with people that I don't know well. Well, is that not true, a little bit true, or very true for you? Or, I follow my mom or dad wherever they go. And is that not true, a little bit true, or very true for you? So some of those are things that parents can see, and sometimes it's not. And so that's what's happening with the scared questionnaire in this age group. For depression, we usually use a questionnaire called the Short Mood and Feelings Questionnaire, or the SMFQ. And that one has 13 questions that ask about mood, enjoyment, energy, self-worth, and loneliness. And we talked more in depth about those exact questions in the previous episode on elementary school. And so it's potentially helpful to listen to that one as well, even if you have a middle schooler, because a lot of times folks will benefit from thinking about what their kid was like as an elementary schooler to be able to sort of understand kind of how persistent these symptoms have been. But more in depth in that. But starting around age 12, we will also often add the PHQ-9 as an assessment for depression. And this is the one that lines up closely with the diagnostic criteria for depression. So around age 12, we feel like that's a reasonable thing to start asking. Over the last 2 weeks, have you been feeling down, depressed, or hopeless? And you can say not at all, several days, more than half the days, nearly every day. And then we'll ask things like little interest or pleasure in doing things. Not at all, several days, more than half the days, nearly every day. So we have 9 questions like that. And then you get a score, and we can tell whether or not that score is sort of outside the normal range. And then we can track it over time as we're doing different interventions to see if we can get improvement in their symptoms. Right. Well, it includes this question about suicidal ideation. And so that is where it's really important, for us to go ahead and ask about that. So the 9th question on that is like, over the past 2 weeks, have you felt like you would be better off dead or hurting yourself in some way? And so that's, again, it's a not at all, several days, more than half the days. And so that can be a real insight into what's happening with kids. Now, that question is positive more often than people would think. Okay, so a lot of times kids will tell me that that's at least several days. Sometimes it's every day. But what's often happening is that when I dig deeper, if that question is true, then it will trigger some additional questions, and we'll potentially at some point do a podcast more about like suicide risk assessment. But it will ask more about, well, can you tell me more about that? Can you tell me about whether or not you have intention to do this? Have you made a plan? Can you share that with me? Those kinds of things. And most of the time, as it turns out, what they're experiencing is something called passive suicidal ideation, which is that it will occasionally come into their head that it would be easier that things would be easier if they weren't around, or maybe other people would be better off if they weren't around. But it's something that's typically transient and that they feel like they have control over it. So they're not ruminating over it. And they're like, ooh, I shouldn't think about that. They're able to sort of push it out. But it's when kids are saying, that's a really persistent thing for me. I'm having a hard time with that. And that's, typically indicates that we need to go to a different level of care.
You mentioned measurement-based care here before. Can you explain what that means in this case?
Right. So a measurement-based treatment to target, the idea that we're going to use standardized questionnaires like the ones that we've talked about, get a score on those, helps with diagnosis, but then also we're going to then intervene with different management tools. Typically, this is going to be medication and or therapy. And then we're going to recheck those question responses later on to see if the symptoms have gotten better. So what we're hoping is that the symptom scores are going to go down, and that would imply that the child's improving as far as their depression goes.
So where does ADHD fit into all of this?
Yeah, ADHD is always in the background of all of these things that we're thinking about. And so that doesn't mean that every kid with depression has ADHD or every kid with anxiety has ADHD. There are definitely kids who don't have that. But I will find that middle school is when there's sort of the biggest jump in the expectation for executive function. So going from fifth grade to sixth grade, like typically in elementary school, you're going to be with the same teacher, or maybe you're going to switch classes once and have a team of teachers, that you're going back and forth with the two. But that's sort of controlled. It's almost like there's an adult there that's sort of escorting you through the day the way that a parent might. Whereas in middle school, the most typical model is that kids will have a different teacher for each subject, and they're supposed to manage kind of all of that, like figuring out like what, like how to just physically get to the classroom, and then figure out like what the nuances are about that teacher and what their assignments are, and keep up with multiple different streams of work that have to be happening. And it's also often tell me that the big jump in middle school is that, if you're in elementary school, your teacher is assigning homework and she may have this much math or some significant amount of math, and maybe it'll go a little light on the language arts. But if you're in middle school and you got two completely different teachers, it may be really high levels of both of those things on the same day or in the same week. And that can feel really stressful for kids when it feels like, they're having to manage that. Now, these are life skills, because like most of us, we're not going to have an adult like following us around every day, just sort of paving the way for things to go smoothly. But it is a big step up. So, for a lot of times for kids, if they have ADHD and the executive functioning is not really where it would be with their peers, if your cognitive abilities are age grade and age appropriate, then you really do need to be in, like that level of work. But if your executive functioning doesn't really allow that, then that can be pretty challenging and stressful and emotional. And a lot of kids just kind of like will conk out on that, kind of give up a little bit. And then sometimes they don't really, this isn't really figured out until, you get a report card and then you can kind of see that things are not going as well. And a lot of times too, in middle school, because you have multiple different adults involved, I think a lot of times parents feel like that their kid can get to the end of the term and be doing really poorly, but they haven't heard from the teachers. That's just not the way things work in middle school a lot of the time. In elementary school, if you're kind of tanking, then a lot of times they'll reach out, but that's just not really all that doable in middle school. You have so many kids, that each teacher has that they'd have to be, on phone all the time. That's just not how it works. And so the kid is kind of responsible for making sure that they're keeping up with everything. And that can be really challenging for kids with ADHD. And then it can exacerbate symptoms of anxiety and depression if they're just not really capable of doing it. And so that is where things, can sometimes start to tank in middle school.
Yeah. Let's talk about treatment. Therapy is normally part of the plan, right?
Right. I mean, certainly for depression. I mean, that's an ideal scenario, is that we've got some therapy involved. And again, and so we had talked about the 4 Ps in the previous podcast about elementary age, but there are predisposing factors, which are often biological for a depression. And so when I think about those, I think about this for family history and sort of how you're wired up as to whether or not you're predisposed to have trouble with depression. And then there's precipitating factors, and those are typically contextual for what's going on in that child's life. So, loss or grief or bullying or things that are happening that tend to, often happen around the same time that you're starting to have these symptoms. So there's almost like a 2-hit hypothesis, like you had some predisposition and then you had something happen that sort of brought it out. And so we can often get a lot of help from therapists by being able to process some of those precipitating factors, especially if it's things like parents are separating or grandpa died. I mean, those are things that are very common precipitating events for kids. They happen for a lot of kids, but they can, be sort of kick kids into sort of a depression depending on, what else is going on for them. And so then we think about those as predisposing and precipitating, and the perpetuating factors are things that are sort of ongoing things that make it hard to pull out of a depression. So if you're having chronic family stress or maybe chronic illness or something else is going on, then that makes it harder to turn things around. And so a lot of times having a third party adult, so therapist or care manager person involved can be really helpful in helping address some of those things so that we can take the load off a little bit. And then there are the protective factors. So that's the fourth P, and that's, the other direction, which is things that can help mitigate the factors that are pushing towards depression. So, so the therapy can work with lots of those things. It can try to increase the strengths and try to mitigate the weaknesses or the things that are precipitating troubles. And that can be extremely helpful. And these kids are at an age where, they're often able to articulate what's going on with them. Do you find that girls are a little bit better able to do that than boys? It just sort of depends. And of course, there's pubertal factors that are involved in that as well. Girls tend to, your brain goes through puberty too. Girls do that a little bit earlier. And so sometimes that's a factor. But they're old enough to reflect to some degree on what their thinking is and whether or not their thoughts really make sense and whether or not some of their thoughts can be like how we can work with those thoughts, especially negative thoughts, especially negative self-talk, those kinds of things. A therapist can really help kids with that. But they're also, young enough that, well, first of all, you can get them good to go to therapy because, they are still dependent on the parent typically to get around and do things. So it's as in high school, that can get harder. If a kid really doesn't want to go to therapy in high school, it is hard to get them to go because they are off doing other things. They often, have the freedom to do that. And so it's just more of a challenge. And so if for middle schoolers, we can get them to go. And once they go, typically it's, they find it to be super helpful. They just getting over that hump of actually getting there. And so that's a little easier with middle school age kids. And then they are just able to, they're in that sort of in between time where they do have some level of insight, but they also are still to a large extent being managed by the adults in their life. And so there are ways to get them to therapy and that can be really helpful. Then there's also medication. And so, like I say this every time, but if I could work up in a world where nobody needed medicine, I would love that because it would mean that there wasn't, nobody was depressed or anxious or had ADHD or whatever within that world. And so we're kind of back to our typical SSRI medicines. So these are selective serotonin reuptake inhibitor medicines. So the most common ones of those are fluoxetine, which is Prozac, escitalopram, which is Lexapro, and sertraline, which is Zoloft. Choosing between those medicines, I will often ask if the child's been on anything before and whether or not that was a good or bad fit. Ask about family history. That can be extremely, extremely helpful. Whether or not they've got other symptoms, there's a little bit of nuance about picking an SSRI for somebody who has ADHD and like what our side effects have been on other medicines. And then the practical considerations, like whether or not they can swallow a pill or do we need to do liquid instead? And then, like everything, insurance gets to say, right? So the insurance is going to have a formulary that's going to say what is covered. And then I need to typically pick from those so that we can make sure that they can actually get the medicine. And then to some extent, too, I have to be aware of what is available in the community. So this is less of an issue with SSRIs as far as shortages of certain medicines. The big issue with ADHD, that's careful monitoring is really essential. We want to see them pretty frequently while we're trying to improve at the beginning. And then once we get on the right path, we can spread that out some. But it is really important to get to where we're improving symptoms. We may not get to what we would necessarily consider to be therapeutic scores on every one of those questionnaires. And that's going to be an ongoing thing. But improvement is important, and it really does make a big difference in there.
To our normal concluding question, if parents could take one thing away from this episode, what would that be?
Right. So, like a lot of these concerns, that depression in middle schoolers is real, and it's pretty common, and it is very treatable. And the earlier we get started, the better. That can really change the child's trajectory. And this isn't about, parenting problems or a kid who this is just like we use medicines to treat conditions like asthma and diabetes, and just in the same way that other organs in the body can have trouble and we treat that with medicine, the brain can have trouble and we treat that with medicine. And so I realize that there are lots of reasons that folks are concerned about that. And I totally understand that. And so I think it's important for us to be able to have that conversation, raise about side effects or how long they're going to be on the medicine, that type of thing. Those are common questions. And I think that when we frame it from the perspective of you're really only in middle school for a really short period of time. For most people, for most adults, we ask them, like, what was the toughest time growing up? It's usually that, right? Yeah, right. And so we know that there's going to be some, bumps and bruises along the way for sure. But if a child is really having pretty profound difficulty, then it's worth intervening and trying to right that ship, because it does have an impact on, what's to follow.
It's such a tough time, 2 or 3 years, but it seems like a decade. But both, living through it, and then as a parent of a
parent, tell you true.
Yeah, for sure, cases. Well, thank you again, Dr. Hoyle. Next up in the series, we'll be talking about depression in high school age teens, where risk and independence continue to increase. Thank you to our listeners for joining us today, whether on the audio podcast, which is found on all major podcast platforms, or via our video broadcasts on YouTube. I need to please rate our content and offer comments and questions at our website, www.nimbleyouthpodcast.com. We want to hear from you and your desires for material. Also, please follow us on social media, Facebook and Instagram, especially at Nimble Youth Podcast. Until next time, please take care of yourselves and the young people in your lives. Bye for now.